So, let's talk about a fun fact. A breast encouragement remedy, mastitis, with cabbage leaves. Researchers do not know why it works, it just does. They think it's because cabbages contain glucosinolates. Enzyme action converts these to pungent isocyanates, which is simply a fancy word for mustard oil. And mustard oil has been used as a home remedy for swelling since forever. So what do? Rinse the leaves, carefully cut out the slit in the center of each leaf without cutting it into two pieces. The leaves will actually be able to fit nicely over your breast without covering the nipple so that they can breathe and stay dry. Punch or poke the leaves all over to release the good stuff in there, and then hold the cabbage leaves in place on your breast the same way you would hold a cold compress. Or you can wear a bra to keep the leaves in place for you. Leave the cabbage leaves on your breast for approximately 20 minutes or until they become warm and wilt. You can also alternatively warm your cabbage leaves to help. It just depends on what's ailing you and what will feel better. Trust me, it really, really works. When I had my first child and my grandmother told me to get some cabbage out of the refrigerator and put them on my breast because I was engorged and I was really miserable. I said, this lady is crazy. But I did what she told me to do, and I'm telling you, it really, really works. Breast infection, called mastitis. Mastitis is a soreness or lump on the breast. It is caused by blocked milk ducts, usually due to incomplete feedings. What happens is bacteria enter the breast through a crack in the nipple. Some symptoms include fever or flu-like symptoms, nausea, vomiting. The breast may be warm or hot to touch. The breast may appear pink or red, and there can be yellowish discharge from the nipple. The breasts will be very tender, swelling, there'll be a pain or burning sensation, and thickening of the breast tissue and lumps. Some solutions to mastitis: breastfeed on the affected side every 2 hours or more to help keep the milk flowing. Massage that area. Apply a warm compress to the affected area. Get extra sleep or relax. A breast infection can occur if the mother is doing too much and is overly tired. See your doctor right away if both breasts are infected, if there is pus or blood in your milk, if there are red streaks on the affected breast, or you experience any sudden and severe symptoms. A nursing strike. A nursing strike is when your baby suddenly refuses to breastfeed. This can be due to baby's pain or a routine change. It really could mean that your baby is trying to let you know something is wrong. It does not mean that they are ready to wean. Some causes of a nursing strike could be mouth pain, teething, a fungal infection like thrush or cold sores, ear infections because sucking increases the pain. There could be pain in a certain feeding position. Your baby could simply just be distracted while breastfeeding. Getting less milk from mother after supplementing with formula can cause a nursing strike, and pacifier overuse, stress, or overstimulation. Solutions to nursing strikes. Express your milk as often as your baby usually feeds. Try giving your baby breast milk through a spoon, cup, or dropper. Continue to offer your breast to the baby. Provide the baby with extra cuddling and touching. Breastfeed while rocking your baby in a distraction-free room. And be patient. Don't take it personal. Some common questions. Should I supplement with formula? No, unless a doctor recommends it. Formula will cause your baby not to want breast milk as much, which could lower your supply. Does my baby need cereal or water? Your baby needs only breast milk for the first 6 months of his or her life. Other substances could cause your baby to want breast milk less. Even when it is hot outside, your baby does not need water or juice, just your breast milk. Is it safe to smoke, drink, or use drugs while breastfeeding? If you smoke, it is best for the baby and for you to quit. It is still better to breastfeed though. Do not breastfeed if you drank a large amount of alcohol recently, and it's never safe to breastfeed your baby if you use illicit drugs. Can I take medicines if I am breastfeeding? Certain medications are safe to use while breastfeeding, but some are not. Many medicines can be passed into your breast milk, so always consult your doctor before taking any medications. Can I breastfeed if I am sick? Most illnesses, including colds, cannot be passed through breast milk. Breast milk actually has antibodies that protect your baby from illnesses. However, if you are sick with the flu, please avoid being near your baby to avoid spreading it to him or her. Have someone who isn't sick feed them your pumped milk. Do not breastfeed your baby if you have HIV or AIDS, untreated tuberculosis, if you are infected with type 1 or 2 human T-cell lymphotropic virus, if you receive chemotherapy, or if you're undergoing radiation therapy. Remember, if any illness requires you to visit your doctor, be certain to inform him or her that you are currently breastfeeding. So if medications need to be prescribed, he or she can prescribe those that are deemed safe for your baby. Does my breastfed baby need vaccines? Yes, vaccines are very important to a baby's health. Breastfeeding can help your baby respond better to those immunizations. Mothers may also receive vaccines while breastfeeding. Can breast milk have toxins from the environment? Certain chemicals can appear in breast milk, but breastfeeding is still the very best way to feed your baby. The known risk of not breastfeeding far outweigh the risk of environmental pollutions. What do I do if my baby bites me? What you can do is put your finger in baby's mouth to take them off your breast with a firm no. Try not to yell to avoid scaring him or her. Gently press your baby to your breast. This will cause them to open their mouth to breathe. Stop feeding right away so your baby does not try to get another reaction from you, because they will. Offer a cold teething toy before breastfeeding to soothe your baby's gums. And you can put your baby down for a minute to show biting has negative consequences. And here are some references that you can go to. Remember, don't worry. Breastfeeding is natural, but it does not always come naturally. There are people all around that can help you gain the skills you need to be successful on your breastfeeding journey. Thank you for your attention. If you have any questions or concerns, just leave a comment down below and someone will get back to you. Thank you.